Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. CT scan guided biopsy of a lung or other chest area lesion. Introduction. A computed tomography scan, also known as a CT scan or CAT scan, is a test that provides very clear pictures of structures inside the body. Doctors may recommend a CAT scan to help in diagnosing various diseases. When a suspicious lesion or tissue damage is found on a CAT scan, a biopsy can be done to try to determine the exact problem. This biopsy can also be guided by a CAT scan. If your doctor recommends a CAT scan guided biopsy of a lung or other chest area lesion, the decision whether or not to have this procedure is yours. This program will help you understand better the benefits and risks of this scan and procedure. Test. A CAT scan uses X-ray technology and sophisticated computers to come up with the final pictures. A CAT scan machine looks like a giant donut, and the gantry is its hole. You will be asked to lie down so that the part of the body to be scanned will be placed inside the gantry of the machine. It is important to remain very still during the scanning. This creates sharper pictures. The test takes from a few minutes to approximately half an hour. A CAT scan of a normal chest shows the lungs and the heart. CAT scan technologists sit in the next room and are able to see you through glass. They are also able to hear you at all times and are able to talk to you. If you have any questions, be sure to ask them. Your healthcare providers are more than glad to help you. Sometimes a dye needs to be given through the vein to help the doctor better see structures inside the body. This dye is relatively safe. It contains iodine. This CAT scan done with the dye shows a tumor. X-rays are used during this procedure. The amount of radiation during this test is deemed safe. However, this amount could be dangerous for unborn children. It is therefore very important to make sure you are not pregnant before an elective radiological test. Some people have allergies to the iodine dye or other drugs, such as numbing medicine, used in this test. Make sure to tell your doctor about your allergies and about all reactions you may have had to any sort of dye used on you in the past. In some people, the dye can cause kidney failure, especially if the patient is on metformin, also known as glucophage, a diabetes medication. Procedure. Lesions found using a CAT scan sometimes may be reached by a needle biopsy. The aim of the procedure is to place the needle in the lesion and draw out some fluid or tissue. A CAT scan is usually done before inserting the needle for the biopsy. The skin on top of the lesion is disinfected and numbed with numbing medication using a needle. A longer needle is then inserted in the lesion to aspirate or draw out the tissue needed by the pathologist. This procedure is usually done while you are awake or lightly sedated. It is therefore very important to remain very still. Further CAT scans are taken while the needle is being inserted and when the needle is in the lesion. This helps the doctor make sure that the lesion is reached. It also decreases the chances of injuring surrounding structures. This tissue that the doctor extracts with the needle is sent to a pathologist who will try to determine the cause of the lesion. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risks and complications. This procedure is relatively safe. There are, however, some possible risks and complications. These are very unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks of lung biopsies include infection at the entry site or in the lung itself resulting in pneumonia. This is very rare. The procedure may cause internal bleeding. The chance of this happening is again extremely rare, but if you develop significant shortness of breath or chest pain, you should inform your doctor. You should also inform your doctor of any medications you are taking, especially blood thinners such as Coumadin or aspirin, because these can cause you to bleed more than usual. The needle puncture may result in an air leak around the lungs. This is known as pneumothorax. A chest X-ray is usually done after the procedure to check for this possible complication. This kind of injury may require the placement of a special tube around the lung to drain the excess air to the outside. This tube is known as a chest tube. Pneumothorax could lead to shortness of breath and chest pain. If you develop these signs, you should inform your doctor. More often than not, the doctors are able to come up with a diagnosis. Sometimes, however, the pathologist may not be able to find a diagnosis. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A CAT scan guided biopsy can be helpful in diagnosing various diseases and lesions. A CAT scan is useful for pinpointing problem areas in the body and helping guide the insertion of the needle to take tissues for the biopsy. As you have learned, be sure to let your doctor know in the case of fever, shortness of breath, chest pain, dizziness, lightheadedness, or any other unusual symptoms. CAT scan guided lung and other chest area biopsies are relatively safe and usually effective in helping your doctor cause a lesion. The risks involved are less than those of open biopsies. Knowing about the complications will help you detect them early if they happen. Thank you for using Explain.